Hello everyone, this is Dr. Bob Brown with Community Coronavirus Update number 86. Today we'll talk about the problem that is right now our hospitals are full, so it's unfortunately we're in a flatten the curve again scenario. We need to slow down spread as soon as possible just because our hospitals are going to get overwhelmed. And how can we can live with COVID and do it better next time? Because we don't have to be like this. We can prevent it. And that's probably what's most frustrating to a lot of healthcare professionals, that we didn't have to have a surge like this. And here you see the headline that children's hospital beds are full capacity in Omaha metro area right now. So kind of where are we starting from? Why is this a problem? So we'll start with data heavy stuff. So this is data, and basically what these numbers are, I pulled these off of the state's website before they took it down. It basically had kids between the ages of 0 and 19 who had been infected with the previous strains of coronavirus, so not Delta but previous strains. This is how you can basically say this many cases, this many end up in the hospital, and deaths. That gives you a case hospitalization rate and a case fatality rate. That's not the same as an infection fatality rate, which people messed up a lot in the pandemic. You have to figure out how many of these people were actually infected, and most people think we only caught 1 out of 5 infections. So really, the infection fatality rate, you'd multiply that by 5 if you're pretty confident in that, and get an infection hospital and fatality rate. You can then use that number and say, okay, of all the kids in Lincoln, Nebraska who are unvaccinated right now, that would be 68,909 based on today's vaccination rates. You might say, okay, well, some of them maybe they got a little natural immunity that might protect them, although that's debatable. But let's say a third of them have some natural immunity and are immune, so then we're down to only 45,893. Would infect everybody, but with an R naught of 6, it'd be about 83% infected. So total infections would be 38,000. Use those numbers. That's 27 hospitalizations and 1 fatality. Problem is, this is old data, and we don't have new data. The Nebraska Hospital Association did ask formally for Governor Ricketts to reinstate the dashboard so we would have new data, although I've not heard that there's any plan to do that, unfortunately. But we need new data so we can make better decisions. We can look nationally and see what's happening in kids, and this is why most people think that Delta virus is actually worse. It's not just numbers, it's just simply worse. If you look nationally, the hospitalization rate for pediatrics at the worst of the last surge was up here. We're already here nationally. And if you look specifically at the southeast region where the surge is the worst, it's even more so. It's almost a threefold higher already, and it's still going up. And so this is why most people think it's worse. The case fatality rate I've heard banded about right now, or case hospitalization rate, is at 1.9%. Well, if we took that 1.9%, when we applied it here, instead of using 0.4%, we'd actually be looking at 131 hospitalizations and potentially as many 5 fatalities here in Lincoln for kids. And that's going to be a problem when our hospitals are already full. So Bryan Hospital is already full in the pediatrics. It's mostly RSV kids, but still there's not any excess space for those kids right now. You could do the same thing for Lincoln Public Schools. You can look at enrollment numbers, which are publicly available, for example, apply vaccination rates, and you get kind of the same thing. It could be 1 death and 22 hospitalizations, but as many as 100 hospitalizations of Lincoln Public Schools kid. And the other problem is long COVID. There is some long COVID in children. I've seen rates anywhere from a low of 1.4% in this study, so conservatively maybe 438 kids, but I've seen rates as high as 4% for long COVID. So you could have 1,200 long COVID cases in Lincoln Public Schools, and that'd be a lot of kids who'd be suffering for weeks and missing out on instructional time, for example. All of these are problems for a school. If you want some deeper dive on some of the pediatric numbers, you can go to your local epidemiologist who went through some of this as well. So it's not just people like me saying this. And then locally, here we are. Lincoln, Nebraska does have a good dashboard, as does Omaha, for example. And their numbers look just like ours. The hospitalization rates are going up fast. They're already where they were back in January. And the problem is that this hospitalization rate is based on infections that happened a couple weeks ago. So what happened, where we are now? Well, a couple weeks ago, we were way down here. So if you double your infections, you're going to double your hospitalizations in 2 more weeks. So if we're already full and hospitalizations for COVID are going to double, this gets to be a serious problem. And this is the time to intervene, because this doesn't even have any of the effect of the Garth Brooks concerts or kids going back to school yet. And so the problem people keep forgetting is linear versus exponential. We naturally think in linear, meaning I work 5 hours times $10, I get $50. I work 10 hours times $10, I get $100. And it's very linear like that, and a little more predictable. But pandemics don't work with it. It's exponential growth. So things will kind of perk like this for a while and then suddenly take off. This is where we already are now for the infections, and this is pre-Garth Brooks. So Garth Brooks, we're not going to see the effect of a Garth Brooks concert for about 3 to 4 weeks. So this is what's on tap, and what's the effect of sending some kids to school without masks? We're going to see that start showing up in about 3 to 4 weeks. So we're already at capacity, and we haven't even seen the effect of that stuff yet. So this is why this is a sort of hitting crisis point, where this is the time to intervene. That we can't wait much longer. There's a study that came out that, even moderate COVID restrictions can slow the spread of virus, but they have to be timely. And this is literally the time. It's really, if we're going to put any slowing to this, we're going to have to do it right away. So we're at the point where we need a directive health measure for indoor masking again. People don't like it. There's going to be a lot of wailing and gnashing of teeth by some people, but it's time for it. The hospitals are already full, and so we just don't have the surge capacity. The problem is it's not beds, it's not ventilators, it's nursing staff. You have to have nurses, and you want your best nurses, and those nurses are already spoken for essentially. So if we get another 50 or 100 or 200 hospitalizations, they're not going to be taken care of by the nurses who do it all the time. They're going to be people who are moved over from other floors. They might be retired nurses coming back that we're going to fill with whatever they got to find. And so this is not a problem. And so once you exceed capacity, coronavirus mortality will go up. It won't be just 0.5% anymore. It starts going up because when you start running out of nurses, your nurse to bed ratio goes up, your mortality rate goes up. And it doesn't just go up for coronavirus, it goes up for everything. And so everything else is still happening too. People still have heart attacks, they still have strokes, they still get in car wrecks. Women still need to have babies. You can't put a hold on that kind of stuff. So there's just not available folks to bring in to handle the surge. Although the hospitals already are starting to not schedule some procedures to try and do their best to try to free up a little capacity at least. And then booster shots. So the joint statement today from the CDC is that yes, booster shots are coming. More detail to come about who and when and which one for which vaccine. But I don't think this is a surprise. A lot of folks were kind of expecting this. I think if you look back at the whole Manaus, Brazil thing I've talked about previously, where they thought they were at herd immunity. They had over 3/4 of the people who had been infected. They thought they were done after that first surge. Lo and behold, 6 8 months later, another surge comes on. Now we don't know if that's because your immunity wanes over time, or if the new variant no longer responds to the same virus. But regardless, 6 to 8 months later, we seem to see this cycle repeating over. If you look at the United Kingdom, they had their first surge. They were going to try to do the natural third thing and then aborted it when Boris Johnson got sick and the Royal Society started running numbers and people said, "Ooh, we can't do that." Now this is a vast underaccountment because this is the time before we had access to decent testing. And then they had the Alpha variant come through, and some of the natural herd people thought, "Oh, good, now we are at natural herd and you don't have to worry anymore." Unfortunately, then the Delta variant came back, and then they're not done yet either. People saw that decline and thought they were over. Well, no, it's still percolating there too. So alpha, initial surge, alpha variant, delta variant every 6 to 8 months. So it's not a surprise, I don't think. It doesn't mean the vaccines are bad. It's just that with coronavirus, you're probably going to need boosters from now and then. And like I said last week, this is not unusual. So for example, diphtheria, tetanus, and pertussis. For kids, you get 1, 2, 3 doses in infancy, a fourth dose as a toddler, a fifth dose in kindergarten, and a sixth dose when you're in seventh grade, and then you keep getting more doses throughout adulthood. So some infections, immunity is just not permanent, and you need a booster every however often. And so we'll find out over time what coronavirus is going to be like. Unfortunately, it's not like mumps, measles, and rubella where you get one shot and 2 shots and then you're done. It's probably going to be more like a Tdap where you're going to get multiple doses initially and then periodically afterwards. It could even be like an annual flu shot where it's a new variant every single year potentially, or even more frequently. It could be that way. That doesn't mean vaccines are bad or they don't work. It's just that each vaccine is different, has unique characteristics because of the infection you're dealing with. And coronavirus is new and unique, and we're going to keep finding out more stuff over time. So this does not mean vaccines don't work or scientists don't know what they're doing. It means we're getting new data because this is literally a new virus and we're going to have a new strategy. Kind of like back in the days, the Huskers were a very run-heavy option team. That didn't work as well in our current conference, and we're having to change our strategy. The same thing happens when you've got a brand new infection you really need to deal with. So, it still works. So even despite some of these issues with some breakthrough infections, we're seeing that most of the people hospitalized are unvaccinated, are the ones in the ICU, and almost all the ones on the ventilator. There may be one, but typically this is somebody who has an immune system problem. So last week when I saw the analysis of Brian hospitalizations, the only breakthroughs who are in the hospital were people older than 65. And as you age, your immune system doesn't work as well, and you're more likely to have other conditions that would affect your immunity. Whereas everybody who was under 65, they were 100% unvaccinated. And so the vaccine, yes, it still works. And I think you're going to see some visualizations for Nebraska hospitals like this pretty soon. And I think that hopefully it's always good to use local data when you have it. And it's good to see the Pope coming out, saying, look, everybody, you should get vaccinated. It's an act of love. You're doing this for your neighbor. You're doing this out of kindness. And this is the way our Christian folks should be acting. As a Lutheran, it really bothers me to see Christians against some of this stuff, because the core of our religion is kindness to others and doing things for our brother. And so it's good to see people coming out like this. So, but we're not going to have to be like this permanently if we just do the right thing. So we can stop a pandemic and live appropriate with COVID if we did what we did with other infections. We need to vaccinate at least 80 to 90%, probably a little higher, just like we do with mumps, measles, and rubella, for example. We need a vaccine verification system, which we already have had for other infections. I'm not sure why coronavirus would be unique to this. We need an option so that you can at least navigate safely to go to schools, concerts, restaurants. We need a mask in common enclosed spaces when we have high spread right now, and we need rapid testing, which is also now a problem again. We're running out of testing supplies, so it's going to be hard to get a test potentially in the near future. And the apps already exist. So I've talked about the Hawaii app when I traveled for my anniversary, but UNL, University of Nebraska-Lincoln, already has a safer community app that they're already using, already does vaccine verification, and that gives you the checkbox when you can go into class or not. We should be ramping this up and scaling this up so we can make all of our other events safer. We should have had this for the Garth concert. I wish we would have. We should have this at least by the Husker games, I would hope, in a couple weeks. Our public health departments, both local and state, have received millions of dollars in stimulus funding. We should be putting it to something like this so we can have safe community events. As I've said before, I am against lockdowns because we know how to navigate all this without doing a lockdown. We just have to navigate things safely, and we can do more and more of what we want to do. So this is something we could do, and I hope we get it up and running as soon as possible. Um, and again, more and more studies coming out. Yes, masks work. There's a few debunked studies that people just keep citing, but all the new studies coming out keep confirming that masks work. This one from the University of Alabama, Birmingham, basically, 18 months, we know this works, and it works both in kids and adults. Some masks are better than others, of course, and use that accordingly, but masks work. And are you going to have to wear a mask forever? No. I said something to that earlier this week. When do you wear a raincoat? Do you wear a raincoat all the time? No, you wear a raincoat when it's raining. Well, right now it's raining. And so, this summer when I'd been vaccinated and rates of spread were down here, I wasn't wearing a mask. Now that rates are spread up here, we're having breakthroughs and our hospitals are overwhelmed. Now I'm wearing a mask again. So if we have this weather app, we can know when we have to put our raincoat in or not. That's why we need the state to put its dashboard back on, so we'll know when should we wear a mask, when shouldn't we wear a mask. And if we can get things under control, get enough vaccinated, and be down here, probably wouldn't throw our masks away completely. I think a lot of people will start wearing masks more routinely, like on an airplane, for example, and that's okay. But we don't have to wear masks all the time. We just have to wear them when they're needed. So hopefully this is helpful to you. Usual disclaimer, these are my opinions, not of the places where I work or the represent organizations where I'm on the board of directors, but at least gives you some idea of who I am, where I work, and where my expertise comes from. Until next time.